Hello, Scott Farkas here. Welcome back to my Bariatric Surgery VSG channel. Today we're going to talk about Mexico. When I tell people that I'm going to have bariatric surgery, they are much less shocked about the fact that I'm having the surgery and much more shocked that I'm having it in Mexico. Just as a recap, I am having surgery on May 27th using BariatricPal MX and Dr. Illan in Tijuana. You might be shocked just hearing me say that if you're considering bariatric surgery. Let me tell you a little bit about how I ended up here and why I am extremely confident in the decision. I've been preparing for this surgery for 4 months. In January, I started doing research after being inspired to go down the path of bariatric surgery. I was working with a local doctor in my area and went to some of the classes that they kind of sponsor to, weed people out, find out if you're really serious about this. And went to some of those classes, and they talk about the surgery and all the different types of surgeries, and in one in particular they talked about insurance, and obesity is a disease, and because it's a disease, a lot of insurance companies will cover it. Honestly, it'll probably save them a lot of money if they invested a little bit in bariatric surgery, and they could eliminate lifetime quantities of insulin and heart surgeries. And if you think about if I have one heart surgery, this surgery, bariatric surgery, would have paid for it, just at a fraction of the price, and you can avoid a lot of these other conditions. I digress. But they talked about insurance and how, even though it's a disease and most of the people in the room would be considered as morbidly obese, that it is a rider on many policies, and that a lot of people just aren't covered. Next day, worked with my insurance provider, and lo and behold, it was not covered. This was after I had spent over 2 months researching it and was going down the path. And all of a sudden it was, well, you can still do it, but it's $20,000 out of pocket. And I thought to myself, after talking to a close friend, that, we talked about buying a car, what's the value of a car? You'd spend 20 grand on a car and not even really think about it. You just put it on a payment. And this particular friend asked me, he said, what's your life worth? Is that worth the value of a car where you make a payment for 5 years and just pay it off? But you get your life instead of a crappy piece of metal that gets rusty in your driveway. And that was sound logic, but I just wanted to kind of look through things. So one of the things that I had done, first of all, I guess I should say, I worked with my company and tried to talk about adding this rider, and I got stonewalled. They wouldn't even reply to my emails. They ignored me, which was fine. I'd rather have them do that than tell me that they might add this in the future, and then I sit around for 2 or 3 years for them not to do it, and I've wasted 3 more years and gotten closer to diabetes and heart attacks and all those other things. I would rather just be told no or be completely ignored, which I was. So in that 2-month process of whether or not I go down this path, I had read several, I'd been reading forums, and I was probably reading an hour or 2 a night about it. So, we're talking hundreds of hours into reading. You can't help but happen upon a lot of conversations and things where people were going to Mexico. And I'd actually always heard really good things. I always thought I would never do that. But I don't remember reading anything negative. In fact, I read a lot more negative about these clinics in the United States that a lot of people go to that had horrific experiences. Even here in the local area, there's a there's only 2 or 3 places that will provide this type of procedure, and some of them are much worse than anything I've ever seen in posted about Mexico. So I started looking into it. I really started researching, and it only took probably a couple days before you really start narrowing in on where the chop shops are, and where these nightmare hellish places are, and where there's some really good care that is offered in Mexico. And so in that period I was kind of narrowed down to a couple, and ultimately started focusing on a particular doctor I kept reading about, which was Dr. Illan out of Tijuana, Mexico. And he takes most of his patients through BariatricPal MX, which is now affiliated with the BariatricPal bariatric surgery forums, which actually are forums for all kinds of, they're not specific to this particular place. But I guess I'll share a little bit about why I have narrowed down to Dr. Illan and decided to use him as my doctor. First thing naturally I did is I'm looking at just Google everything on this guy, so I'm looking at forums, I'm looking at Google posts and blogs all over the place, and I'm looking for YouTube channels. It was hard to find YouTube anything on Dr. Illan, which is why I'm actually, part of the reason I'm creating this is just because I know people will have questions about maybe whether or not they go see this guy, and we'll see how this turns out, right? Maybe it'll be a shitty experience, sorry, pardon my language, and and then you'll get to find out, right? But so what did I find from reading blogs and YouTube channels is that patients, first of all, they love this guy. Second of all, it is a state-of-the-art facility. When you read about this hospital, it's called the Oasis of Hope. You see the pictures inside. I mean, it's just immaculate, clean. Everything in there is state-of-the-art. I think the hospital's only a couple years old. Going back to what I said earlier, you go to a lot of hospitals and clinics in the U.S., and they are just run-down old places that you just wouldn't ever want to be in. And this place is just immaculate. And there's a lot of people that have been on the forums, and I'm actually in a private group that they have on Facebook, which if you're serious about this place, you should ask to be in part of the group. There are multiple people that I've seen kind of come and go through the program that are, actually in the medical field. And there was a couple in particular that were, one was a surgery assistant, a surgery, I don't know what you call it, a nurse that's in the OR, operating room nurse. And said that the place was cleaner than the hospital where she works in the United States. And the tools were state-of-the-art and everything. So that was really nice to hear that this facility is as good or better than what you'll get in the United States. Number 3 was that the care that people were receiving at this facility was better than what they've had in the U.S. And that was shocking to me. A lot of people who obviously are morbidly obese like me have had other problems where they've had surgery. I've had back surgery, and most of them have said, this facility is cleaner and better, and I just saw that over and over again. And the care, so if you've had a procedure before, everybody knows that nurse where you hit the button and they don't ever come, and they come 20 minutes later. And the one thing I consistently read about this facility is you push that button, they're in the room, and they have so few patients that they're working with. It's a very specific set of caregivers that are working with just a couple, 2-3 patients. So when you need help, they are right there, which is something that is pretty rare in the United States these days. In the hospitals in the U.S., they just pack people in those places, and everything's efficiency and profits, and it's tough to get really attentive care because they're helping so many people. So another thing that I found fascinating about this particular facility, and others in Mexico as well, is the post-op care in the U.S. You typically have the surgery and they kick you out the next day. It's one night and you're gone. I'm going to have 4 days I'll be there 5 total days, but 4 days of post-op care, which is fantastic. Which leads me into my next reason that I have chosen this particular facility is Dr. Illan is accessible. He is available on Facebook. You can message him, ask him any question you want. One of the questions I asked about was leaks. Everybody, when you have a VSG or a bypass surgery, you want to, everybody's concerned about these leaks that can be life or death. And one of the things I learned that Dr. Illan does, that not everybody does quite as thoroughly as he does, is he does 3 leak tests. He actually does 2 during the procedure, and then you do one where you drink the disgusting liquid, and they do an x-ray to make sure it doesn't leak. I don't think they have that, I think there's typically 2 when you do it in the U.S., where they'll do 1 during the procedure, and then I'm pretty confident they would do the x-ray bariatric fluid test as well. But yes, he's extremely accessible. The one thing I found when working with a United States doctor is you have a question, you have to set up an appointment, and you try to have all the questions you have ready to go, and your bariatric surgeon will come in if you go through their classes and everything to get to this person. And because it's not covered with insurance, they're going to charge you $150 or $80 or something to sit down with this guy who's going to be incredibly rushed. You're going to get 5 minutes with him to ask everything that's on your list and feel rushed in asking those 7 or 8 questions. And then when you leave on the way home, you're going to realize you didn't ask a question. And then you're going to have 5 more questions come up during the week. And the only way to ask those questions is to set up another appointment for $150 and sit down with this guy or girl and go through it again. I don't deal with that. When I have a question, I get on Facebook Messenger and I message Dr. Illan. And it is amazing to me that he typically answers within an hour or 2. You can kind of tell when his surgeries are, because there'll be these small little breaks, and sometimes I can follow along on these groups that I'm on with who's in their particular facility, but extremely responsive, and he answers every question whenever I want to know, the same day or within a couple of hours, and sometimes within minutes, and that's fantastic. Reason number 6, Dr. Illan only does up to 3 procedures per day. If you read about some of these other places in Mexico, they're doing 8, 9, 10 people a day. They also charge only like $2,000. Dr. Illan's about $5,000. I don't want to be the 9th guy in the day that the doctor's working on when he's tired. So I like that he limits himself and keeps it to 3 procedures a day, and he's done for the day. So you get fresh hands. I like that Dr. Illan also has done, I think on his website, I think through his entire residencies and everything, which, by the way, I think his residency, I don't remember what was on the site, but basically one of his medical doctor, becoming a bariatric surgeon, was actually performed in California. So he's not, there's more than just Mexico pedigree there. He does have experience in an American hospital, but I think he had done like 8,500 bariatric surgeries, and I think 4,000, 4,500, something like those were his own. A lot of doctors in the U.S. that I was looking at had only done like 1,000, 1,500. 1,500 was kind of my mark of what I was looking for, but he's done 4,000, even only doing 3 per day, which again is fantastic. Number 7 was that Dr. Illan does a state-of-the-art procedure. After doing a lot of research about the sleeve and the techniques that are done, a lot of this is because I've got this friend that's kind of been my mentor through the whole thing. He brings up things too about what you want to make sure your doctor does. Dr. Illan clearly does, and does a state-of-the-art procedure and make sure that it's done right and where you'll be successful with it. And if you're somebody who doesn't have, gastric, acid reflux before the procedure, I think everybody has it for little bit after, but odds are that you'll do very well and not have reflux problems long term afterwards. Really, really important. So last, and probably one of the most important reasons I selected Dr. Illan was his statistics. Again, being able to talk to him. When I talked to my original surgeon, one of the questions I asked was, what are your statistics? The statistics for specifically for leaks and for a stricture. Strictures where basically your stomach, nothing will pass through it, and it's a life-threatening thing because food can't get through a stricture, and then you start starving to death, and they have to put a balloon down your throat and expand that. And so I asked him those two things, because the worldwide statistics on that is 1% of people will have a leak, and 1%, just under 1%, will have a stricture. Dr. Illan was very quick to reply that out of the 4,500 procedures he has had 2 leaks. Both were identified at the time of while they were still in Mexico, at the time of the leak test. They went in for an immediate surgery, and both were repaired and recovered very well. He did not have any situations where after the 4 or 5 days of post-op care, people went home and then suddenly had these conditions. The other statistic was that with strictures, he claims, these are claims, right? So take it for what you want to take it for. May or may not be completely true, I don't know. But as far as strictures, he claims he's never had a stricture. He then went on to talk about the particular type of insert. So when they do the sleeve, they use what's called a bogey, where they bring basically a little cylinder down your throat into your stomach, and they pull the stomach over it. You should watch the surgery Dr. Illan does on YouTube, which is fantastic. You can actually watch it. And so they bring this cylinder into your stomach, they pull the stomach over it, and then he follows the contour of the cylinder. But he uses, I think, a size 35 French bogey, and he says he's never had a stricture with that. So, and it's still very effective. It's not like it's too big or something, and you're not going to get the success. I followed a lot of his patients, and they've had incredible success. So his statistics are off the charts, amazing. And again, going back to the beginning where I was looking at these blogs and YouTube and everything, it was really concerning to me that I could not find anything anywhere where somebody did not like their experience using Dr. Illan. So those are my reasons for choosing Dr. Illan and BariatricPal MX, and I hope this was helpful. Thank you.